This is OSDHCI, Walk-thru for healthcare providers. To start, you will navigate to the website osdhci.health.ok.gov and follow the instructions that have been provided for external providers to log into the system. For the purposes of this demonstration, I'm going to be working in our testing system, so I will navigate there now. I will log into the system and will be immediately directed into an individual search page. You can see that we've stripped out a lot of things that you normally would see in Fido to help streamline your role and make it simpler for you to add in COVID information. You'll see the instructions to please use the search box to see if the individual you're looking for is already in the system. And if they're not found, you can click on an Add New Case button to enter all note and information. If you need help, you can visit our user guide. By selecting this, it will download and you can open it, but this is the same user guide that we have provided along with the OK HAN. To start, when you search for the individual, you can see that you have 5 parameters here that you can search by. Many of you are familiar with searching. I've been doing it for years. So I tend to use first names and dates of birth. Those kind of are the most static things to me. We see phone numbers change a lot. We see, last names change with marriages and culturally and the way facilities may handle those names and the way people handle them culturally. They're not always consistent. So for me, I tend to start with a first name and a date of birth. Whatever you search by, the system is going to display records that meet your search criteria. So for instance, if I search for the name Lynn, I will see a list here of everyone in the system who has LIN as a part of their first name. We can see there's 101 records. We can switch between pages. We can extend out the items per page if we want to see it all. But if I got back this many records, I would be looking for some additional information I might add in to make it a little more straightforward. However, for the purposes of this demonstration, I do know that I am actually looking for Lindy Hearn. That's her date of birth, and I'm pretty sure this is her. And so in order to get into this record, to view the details, to give me a good idea if this is her, you see these case investigation IDs or these OSDHCI numbers here. These OSDHCI numbers are really consistent with the old Fido person record. So in Fido, you had a person record, which was an overall record of the individual and everything to do with them in our system. Depending on your permissions, you might see various diseases or infections listed for an individual, versus a case record, which is within the individual record and is specific to an incident of morbidity. So what we can see here is really that individual record ID. So we're going to go into Lynn's record here. When we get in here, you can see it's pretty simplified. This is her demographic information. We want to check all of this and make sure that it's updated. Things of real importance are the phone numbers and the addresses to make sure it's going to the right county. Spelling of her name is very important. And so if we got in here and we found this and we said, oh, actually her name is Lindsay. She goes by Lynn, and some people call her Lindy, but really her name's Lindsay. Then we could extend her name out and we could correct that at this point. If we saw that her date of birth was off by a year, we could update that as well. We also, anytime the sex is listed as anything other than male, you will get the currently pregnant question, and it is required to be answered. You select all races that apply for the individual. This is one of the only drop downs where you have the ability to select multiple things. And so when you are in any drop downs with the ability to select multiples, you do have to click outside of that box to get it to go away. We go in here and we say, oh, actually, her address is 1820. And you can see here that our address searches are powered by Google API. And so we can select from a big long list of all these different addresses that meet the criteria as you're typing. However, you want to be sure that whatever you are typing is consistent with the actual address. So we can see that there is a South Perkins Road in Memphis, Tennessee as well. Um, but we are not wanting South Perkins Road in Memphis. We're wanting the one in Stillwater. Definitely pay attention here, because if you accidentally select one of these out of state ones, once you update the record and save it, any active investigations will be immediately sent for interstate notification based on that update. So that would actually send them to a different state. So to ensure that you are selecting the right address and that the city and zip code are lining up with what you expect them to. And we could also look at this and say, well, that is a good contact number for her, but sometimes she doesn't answer that number. And so we actually have another number for her, and that she may answer at. And so we can provide that information. If you're aware that the person is an enrolled member of a tribal group, you can click that they're an enrolled member, and you can click on the tribal affiliation and select multiple from here as well. Again, having to click outside the box in order to get that to save. And once we've updated all of Lindsay's information, we can click on save. And you can see all of those updates have been made. Typically, what you're going to do when you're coming into a case record or to an individual record like this is you're going to want to update these demographic informations and then navigate over to case records and go directly into their active investigation or a previous investigation that you're adding an update to. Before we go into the case record, though, I want to give you an idea of these other tabs on here. The test results tab is going to show you any test results for this individual, regardless of whether they're current or older. So every test result that we have in regards to COVID-19 will be displayed here. Those will be what have been sent in through our ELR reports. So you can see that Lindsay's record does not have any of those here, but they would just be displayed in this row. Vaccine records, if we had any of those, that would also be displayed in this row. If we had previous knowledge of her having one dose and maybe you had some information on a second one, and the first dose was listed here, there actually would be an edit button where you could edit it and update some information, but that is not required of you. This conversation tab is not something that you need to worry about at all, but it is something that is a little more important within the case record, and so I'll discuss it a little more there. Here is the case record tab. We can see that Lindsay has a current case record going on. However, she could have been also infected with COVID-19 in June of last year. And if that was the case, she would also have a case record here that would show those investigation start and end dates. You can see that this is active. Any inactive investigation will be listed as beyond investigation as the disposition. So that's what we would expect to see on something from last year. We can always go into those records and try to make some additional notes on them, but we need to be looking to make sure that we're updating the correct case record. If we made a mistake and we did not pay attention to that and we didn't click it to go in this record and we just clicked add case, we could add the case and the system should dedupe that information. However, in an effort to not create duplicate case morbidity, which really mess with our numbers, we suggest really pay a lot of attention there, and make sure that you're attaching your information to what is current. But if there's not anything current and you're the first person to come in here, all that's listed in her record is her infection from June of last year, you'd be able to go ahead and update her information here. And I'll be going over these tabs with you within the case record itself. So on the exposure record, if she had been named as a contact at some point, you would be able to see that she has exposure records listed here. Here is a notes section. You have the ability to upload files by clicking on the upload button and scrolling through your files to see what you may need to upload. And I'm sorry because okay, so you can see when it's there, it says file selected successfully, and you can see the name of your file. You also have the ability to delete it. So if you errantly add something at this point, you can still delete it yourself, but you'll notice that you don't have the ability to save until you type something in, and that is when it'll become blue for you to save. I am not going to upload this document. I'm instead going to delete it because it doesn't have anything to do with Lindsay's record. And so if you want to delete it, you just say yes at that point. If you errantly save with a document attached, you can have that deleted by emailing OSDHCI help at health.ok.gov and giving us the case investigation ID, this number right here, and for the patient, and letting us know the date and the time that you created the file that needs to be deleted. If there are files on here that you would like to look at, you can always hover over these three dots and have the ability to view that file that was previously uploaded. The edit history, the merged individual, and the vaccination history are not tabs you're going to have to worry about. They show interactions in the system as people have made changes. And so if we ever have to go in and kind of troubleshoot where an issue happened, we can always do this. For the merged individual, that's if we have deduped them and realized that we had, two people who were actually the same person, and that information would be displayed here. And then the vaccination history is for any updates to those vaccine records that I mentioned. So again, your standard flow is going to be searching your patient into details tab to update their demographic information and straight over to the case record. Something I failed to mention when I spoke about the notes is that, again, these notes are on the individual record. So the notes you want to add here are notes that have to do with the person. So maybe a living situation, maybe they're, in a group home situation, maybe they have multiple AKAs. We only have a room or one in the details tab. So maybe they have 10 and you want to list them here. That's a great thing to do on the notes for the individual. However, things that are specific to the case record, like a chart, you are going to want to use the notes section within the case record. And I'm going to show you where all of that is now. So we're going to follow the hyperlink into our case record. We can see these exact same drop downs that I just showed you a moment ago, only now we're going to go through them. In order to update this, we're going to click on the edit button. And we're just going to go tab by tab. There's not a ton of information that's required, but we do want you to update as much as possible. There's nothing required on those first two tabs. For case classification and identification, the first data positive specimen collection does become required if the patient is asymptomatic. So the fact that it's not required right now gives me a pretty good indication that when I get down here into my clinical and symptoms sections, I'm going to see that this patient is symptomatic. However, if we remove that, this does become required information. Please enter any positive specimen collection dates the first positive specimen collection date that you have in here for this event. So if you know that Lindsay tested positive last June and you have that date, we don't care about that for this case record. We care about Lindsay's recent test and the reason that you're updating her record now. For hospitalization and ICU and death information, there are quite a few required fields here. There's actually two. So if we say, no, the patient's not hospitalized, you can see that was the patient hospitalized and did the patient die are the two required questions. If we say yes, being hospitalized, we get some additional questions. If we say yes, they were hospitalized for COVID, it's going to ask us for the hospital name and admissions and discharge. And if there was an interpreter required, if they were admitted to the ICU, and if they were transferred. If we said yes, they were transferred, it's going to give us more pop-outs. Where did they transfer? Where were they transferring to? What was the admission? What was the discharge date? And then did the patient die? If we say yes to that question, it's going to ask for a date of death, but we are going to say no, Lindsay is still alive. Moving on, we have the case demographics. A really important question here is an interpreter required? If an interpreter was used in your facilities, it's a really great time to tell us that here, because we have something called a call script, which is what investigators use to actually conduct these interviews. And this information does pull to the call script and helps them know from the get-go if they need to involve our language line or other interpreters to help our patients get streamlined care. This is the healthcare worker information section. If we say no, it's just this one question. If we say yes, we do have some additional options here to say what is their actual occupation and what is their job setting. It's important to add that information, but it's also really important to add healthcare worker information under our high risk setting, and I'll show you that momentarily. Now we're going to look at the exposure information section. This is going to be very in line with things that you have already seen in FIDO. We do have dropout lines here for each selection to give additional information. If you have that information, please provide it. If you know that the person's been in contact with a positive COVID-19 case, you can add that information here, as well as if they were part of an outbreak. Um, so update this accordingly. Again, it's really, really important to, if we know that they were at like a community event, this is how we identify outbreaks and help stop the spread. So if that's known, please do share that information with us. As I mentioned, we've had some changes to the high risk settings. COVID has taught us a lot of things, and we've learned that we had some spaces that we really needed to be paying specific attention to, such as dialysis centers, indoor sports arenas, as well as overnight camps. You can see this is another one of those sections where we have multiple clicks. As we click them, we get sections to fill out additional information for each place. As I mentioned before, it's great to enter the healthcare worker information up here, but it's very important that that information get added down here because we use these risk sections to determine whether or not a client qualifies for us to send them through our automations. And for high risk investigations, we like to handle those with our humans. So we would go ahead and say that they worked in healthcare here, and we could add in, their information at where they're working and enter any known information. And so you can do that for each selection. If you don't have the information, but you know that they were in one of these settings, it's still completely appropriate to check them. You can see that none of this is required, but it does give our investigators an idea of things that they might ask the client when they speak with them. In the clinical section, as I mentioned before, there was no test result, a test date on this. So we can see that they are symptomatic, and that's why that wasn't a required question. It tells us what the onset date of their symptoms are, and it displays some symptoms. It says fever, but no to everything else. If when we saw them, they were experiencing, seizures and myalgia and wheezing, we could add that here as well and just go ahead and update it. We also would update any complications from their COVID-19 illness or underlying and chronic conditions leading up to it. And we have the ability as well to update any known COVID-19 information. So if we say, the PCR wasn't done, but an antigen test was, and then we can say, our facility, as well as you can see the facility list here is pre-populated. You may have to do some typing because it is quite a lengthy list. I believe this was thousands and thousands of lines long. And so it is a smart search, just like some of those other search options that you saw. And so you can see as you start typing that different pieces do come up here. You would also update any other pieces that you need to in terms of what type of test and the specimen collection date as well. And then once you're done, you would click save. We have some required fields that were not done. We can see here that when you try to save and you have required information that has not been added, it will pop out all the sections. So if there were multiple, it will pop out every section and highlight in red the text of what is needing to be updated. So we had said that the patient was hospitalized for COVID-19, and so we just needed to add that hospital name in there. And so now we can save. We can see here that the case record was updated. And so we've now effectively updated Lindsay Hearn's record. As for the other tabs that are located here, again, you have a test results section, much like the individual record. However, these test results are specific to this incident of morbidity. We have a conversation tab. I mentioned that it was more important over here. It's still not something that is vital to your role at all, but if we have been having interactions through automations with a client, you would be able to see our text messages displayed on the left side and their responses displayed on the right. So you would be able to tell any communication we've had with them via text. If they have named themselves to anyone who was also infected, they would have an exposed case record here. You also can use a CR number. So if you had worked, say, Lindsay's roommate, and you had just put her in, you knew her case record number from right here, you could always put that in. But again, it is not expected that you will. If you ever wanted to add contacts, again, you could add contacts by searching and clicking on add new contact. My suggestion for you all would be to say no automatically to these questions. Enter the minimum information, which is a first name, last name, phone number, and the last date of exposure. And clicking save will then kick a text message out to that individual to try to notify them that they are a contact. Again, we don't anticipate healthcare workers adding that information, but I want you to know that it's there. This is the notes section again. It works exactly like it does in the individual record. However, this again is more specific to the case record. So this is where you'd put any kind of chart information and things like that. This is a really great place just so that the person who looks at a case record would come here to look at the specifics regarding this case. The symptom history has to do with any time that the symptoms have been updated. We just updated the symptoms and said yes to a few different things, so you can see that they're highlighted in a pale yellow. The interaction list has to do with the call script that our investigators use. And so if they have actually called an individual and been able to do an interview with them, you would see interactions with the call script listed here. That may be information that is helpful to you, but it may not be. And again, an edit history that I doubt you will need very much. So that is how you locate a case record. You find their individual record and navigate into the case record after you have updated their demographic information, and then you update the details, add any notes that you may need, and you're done. If we go back to the individual list, and this time we are looking for a patient. We are looking for Stella and we're searching, and actually none of these Stellas are the one I am looking for. And so we're going to say add new case. Now you're going to see the exact same details that we just covered, only this time you're going to see an individual information up at the top that does display all of the demographic information that previously you saw in the individual record. We could go ahead and add some information for Stella to add her. You can see all these required bits of information. Another really easy way to see what is absolutely required to add a case is by clicking on save before you're ready. And like I mentioned before, it's going to highlight in red anything required, and it's going to pop out every section. So we can see that the symptoms present during the course of illness is required, but if you say asymptomatic, then you know that we're going to have another question become required, which is the data collection of their test. So we're going to go ahead and fill this information out. We are going to add in an address. This is the one we want. We're going to add in a date of birth and making sure that we get the correct information in there. We're going to add a contact number for our patient and update again any and all information. There's lots of things that aren't required, but it's very helpful for us to have this when verifying the identity of our patients. There's also information here regarding the guardian. And so if they have given permission to speak with the minor directly about the situation, you are welcome to fill that out. But if you are dealing with a minor and you know the guardian information, it is very important this is filled out as well to ensure that we reach out to the guardian first. We're going to go ahead and say no, that the patient was not hospitalized, nor did they die. And we're going to say that the patient's symptomatic. If we say the patient is symptomatic, we have another requirement here. What was the onset date? And so we're going to say they became symptomatic on the 25th. If we tried to save at this point, we would have a problem because we can see as we pop this out that all of these have to be filled out before we can save. They are all required. There's a really easy way to work around this and streamline it for you when you're adding a case, and that is simply by saying first that the patient's asymptomatic, which automatically adds a no for all of these. And you'll notice that you go in, and as soon as you turn one of these to yes, the system automatically recognizes that that is symptomatic and updates that for you. So that is just kind of an easy workaround to help you streamline your case entry. And once you've added all of the information that is required and all known information, then you're going to click save. And you can see here at the top of our list that it kicks us back to that Stella Keen was created. And so if you need to go back in there to make any updates or add any notes, and or check to make sure you didn't make any mistakes, that's when you would do that. You could navigate directly back into her case record and make additional updates there.